Hey everybody, welcome to another series or episode of Doc Talk. I'm Dr. Justin at Fulk Chiropractic. So this is day 5 of 5, talking about low back pain. So this is the one, this is disc herniations. A lot of people either have a disc herniation or think they do, been told they do, or not sure if they do. There's a decent chance a lot of people do. And I'll go through some of the numbers on that too. So starting out with a disc herniation, if it is what's going on, you may have some localized back pain, at least at the beginning, and then it may start to go down the legs. Pain, numbness, weakness into the legs. If the condition gets really bad with the disc that just really fully ruptures, it can cause a condition called Cauda equina syndrome. I've never seen it in almost 17 years of practice. Dr. Fulk, my dad, has seen it twice in 40-some years of practice. It's extremely rare, but it's extremely serious. If you develop what they call saddle numbness, where you get numbness anywhere that would touch a saddle if you sat on a horse, real severe weakness into the legs, loss of bowel and bladder control, real significant problems. Emergency room, surgery, catch it quick, no problems down the road in most cases, but you don't want to let that go on. If you have anything like that, any questions on that, emergency room. So these disc herniations, like I said, a lot of people may have them that don't know they do, they think they do. So disc herniations can be asymptomatic in a lot of cases. Studies show that about 30% of disc herniations in 30-year-olds are asymptomatic, and then getting up to 80-year-olds, 84% of disc herniations can be asymptomatic in 84-year-olds. And there's reasons for that. Things change as we age, and the discs don't have as much water content, so they don't bulge quite as much. But that's the statistics on that. There are varying degrees of disc herniations. So you can tell I'm an artist. So I've got my nice little diagrams right here. So this is if you were looking down at a disc, all right? What I can compare it to is a jelly donut. If you've got a jelly donut and you've got the glazed outer lining, and then inside that you've got the rings of the bread, and on the inside of that you've got the jelly. So that's the way to think of that. If you start pressing on that donut, that jelly inside will start bursting through those inner linings of the bread. And that's what's called a protrusion. So you can see the little jelly material here. I don't know how well you can see this, so bear with me. So that can start to bulge out, but it doesn't get to the edge. It doesn't bust out of the glazed lining. So that's a protrusion. Getting into a disc extrusion, that jelly can actually bust all the way through that outer glazed area. So that's a disc extrusion. The last step is what's called sequestration. So you got where the disc extrudes, and then pieces of that jelly will actually start to come off and break apart and go into where the spinal cord runs down. So then looking at here, this is the spinal cord running straight down the spine behind the disc, and then you got your nerve roots branching off at every spinal level. So when that protrudes backwards, it can start putting pressure on the spinal cord itself, or more commonly, it'll put pressure on the nerve roots coming out, and that's when you start getting symptoms down into the legs, and then the other things I talked about. So that's what we're talking about with a disc herniation. So people ask, can you treat a disc herniation? Well, there's a lot we can do for disc protrusions, some disc extrusions, those types of things. When you have sequestration, there's a lot of studies that show too that in a sequestration, over time your body will reabsorb that material, and then your symptoms can go away. But again, you don't want to let it get severe symptoms. Surgery can be beneficial in some cases. However, there was a study that was done that showed up to 97% of disc herniations can be managed without surgery. So there is a good chance. So starting out, start with something non-invasive. Start with some natural health care. And you may have some really, really good benefits and improvements with it. So let's switch back over to here. So disc herniations, typically, the symptoms will get worse when you're standing for a long period of time. So if you get off your feet and you relax, and leg pains and those things start to go away, but then you get on your feet, you go to the store, you're walking around a lot, and you may feel you need to lean on your grocery cart, something like that. The longer you're on your feet, the more that presses down on that disc, pushes that disc material out, puts irritation on the nervous system again. So treatment options, pretty similar to other things I've talked about as far as what we do in here. Adjustments can help to take some of the pressure off the disc by returning function to the facet joints. Spinal decompression therapy, that's why we got the table. You take that pressure off of those discs, and that disc material can resorb back up and take that pressure off the spinal cord. It's a great treatment for a lot of disc problems. And then again, stretching and strengthening exercises, strengthening up the core, exercise in general can be beneficial. Expectations. This is tricky. Disc herniations are really tough to tell, but a lot of them will start to respond within the first week to two of care, starting to have less radiating symptoms, maybe starting where it's instead of going all the way down to the foot, it's only going down to the knee or so, or just starting to disappear, get less severe over time. 2 to 6 weeks of care, seeing something fairly aggressively, 3 times a week for a couple of weeks, twice a week for a few weeks after that, and spacing things out using the decompression table. Then in a lot of cases we can really get the symptoms under control. So I think that's about all I had. If you have any questions, put a comment on the video. Next week I'm going to do an episode on sciatica. Really commonly confused with these low back problems I've been going through. It's kind of related in a way, but it is different and a very specific problem. So tune in for that next week. Until then, stay healthy.